Good morning. You're welcome to today's class. We are still on the course Basic Dispensing Theory, ability 152. Ability 152. Yesterday we discussed the classification and types of powders, and we went down to the preparation of powder. We started with the preparation of divided powder, and today we'll start from preparation of bulk powder. Because I got information that most of you didn't understand what we did yesterday. I don't know whether it's true or not. I don't know. So someone should help me with the course material. Okay. Thank you. Hope I can answer some questions. Alright, so yesterday we discussed, we used hyoscine hydrobromide as an example, and we discussed how to prepare divided powder of hyoscine hydrobromide. So, using the same method, you can also do this preparation. Using the same method, let's see how far we can go with this. The question says, prepare 18 powders. 18 powders, each containing 140 milligrams of ibuprofen. You know ibuprofen now? So prepare 18 powders, each containing 140 milligrams of ibuprofen. If you look at this, you will realize that each powder will contain 140 milligrams, right?
Yes.
And this 140 milligrams of ibuprofen is weighable, right?
Yeah.
You can weigh it using class B what? Balance. You can weigh it. So you don't need to pass through that thing we did yesterday, trying to dilute. There's nothing to do what? Dilute again. Are we together?
Yes.
There's nothing to do what?
Dilute.
In fact, do you think you need diluent again?
No.
Is it necessary? No. Because the minimum that can be in a raw powder is what? 120. So, but this is 140. You see, this will not, you don't need so much calculation here. True of us? Good. So, here now you can prepare. You can target 20 powders because of what? Losses. True of us. You can make an average of extra 2 powders and get what they're looking for. So tell me now, at this point now, I think you should say something now. So tell me, what do you think we can do about this powder? Someone should tell me. What do we do about this powder, to prepare this powder? Tell me. Is what?
If 1 gram is equal to 120.
Huh? If what?
1 gram is equal to 120. I'm making use of 20 powder, and this is 20 gram. You now do equal to X plus multiply. When you get the number of grams altogether, you now minus it with this thing to get.
To get what? Remember, each powder must contain. Well, you cannot bring down the. This is the strength of ibuprofen in each powder. You cannot bring this strength down. So whatever you are doing, this must contain 140 milligrams. But the question now is this. The question now is this. Will it contain? Will this contain? Do you need to add diluents? I'll give you 3 minutes to work on this. Get your paper and start doing something. Let me see what you are doing. At this juncture, you should be able to do something. Yes, you should be able to do something. So I give you 2 minutes. Do something about this. I trust you can do that. Yeah. So tell me what we need to do. I am waiting. One minute gone. Yeah. 2 minutes about to go. Any answer? Okay, your time has elapsed. Any? Okay. No, say it.
If one powder is 140 milligrams,
Okay.
and you're making use of 20 powder, you have to times.
Okay.
20 powder times 140.
Okay.
And you give me 2,800
Milligram.
milligrams.
Okay.
Then we now do for wrap.
Okay.
And we are making use of 20 wraps.
Okay.
And one wrap is about 120 milligrams. And in the first time that we got 2,800,
Okay.
all of them are for ibuprofen. There is no lactose in it.
Okay.
Then for the wrap, we got 2,400.
Okay.
If we do 120 times 20, we got 2,400. So I don't know whether I should minus them. That's just my problem.
Okay. Any other? No other person? Alright, so now look at this question. Prepare 18 powders, each containing 140 milligrams. Two things you should note here is that number one, you know, this ibuprofen can come as pure ibuprofen. Remember what I told you about drugs and medicine. The paracetamol in powder form. These companies that manufacture drugs, like name the different companies that manufacture paracetamol in Nigeria. Some of them import paracetamol powder. That is the drug itself, the active ingredient as powder. Now they will not get they do not get excipients and combine them to formulate the tablets. Am I communicating? Or any other dosage form? The same way, you also have ibuprofen as powder, pure ibuprofen. So this preparation can be done in two ways. The first way is that you can prepare ibuprofen if you have the pure ibuprofen in your pharmacy. If you have the pure ibuprofen, you can use the pure ibuprofen to package it as powder, as what is it called? Wrap powder. But here you don't need diluents, because ibuprofen, this 140 milligram, is above the minimum weight you can wrap in a powder. The minimum is 120. Had it been this dose, this strength is less than 120. You start looking for diluent to bulk it up. That's when you start doing this calculation. But it's not less than the amount you can wrap. So you don't even need a diluent at all. You don't need to add any bulky agent at all. The second part is that you can weigh it directly. You don't need adequate weighing to weigh it, because the minimum you can weigh using class B is what? 100 milligrams. It's above 100 milligrams, it's 140. So all you need to do is this: calculate for 20 powders. Because remember, if you can get for 18 powders, and you now after taking the 17th one, 18th one may not be complete. You may not even get up to 17 powders set. So the best thing to do is to go for 20. Since you know that one of the powders will contain 140 milligrams, so that means for 20 powders, for 20 wraps, so one wrap will contain what?
120.
One wrap will contain what?
120.
That's the issue you are still having. It must not be 120 milligram. I said it at least minimum is what? 120 milligram. It should not be less than 120 milligram. It can be 140 milligram. It can be 300 milligram. But it should not be less than what? 120 milligram. So because it's 140 milligram, you don't need to just go straight. So one wrap should contain 140 milligram of what?
Of ibuprofen.
Ibuprofen, good. One wrap should contain 140 milligram of what? Ibuprofen. But we are preparing for what? 20 powders. So 20 wraps should not be what? Should contain how many?
X, that's 2,800.
Simply say 20 times what?
140.
140 milligram, which is what?
2,800.
Milligram of what? Ibuprofen, which is certain as. Can we change it to gram? If you change this to gram, it becomes what? How many milligram makes 1 gram? How many milligram makes 1 gram? 1,000 milligram makes 1 gram. So 1,000 what? Milligram is equal to what? 1 gram. So if you have to move 2,800 milligram to gram, what do they give you? 2 point what? 2.8 what? Gram. That's what it, so in grams this is what? 2.8 gram of what? Ibuprofen. So here now, all you need to do is this. Remember, you take this is just the calculation part. I hope you know. This is the calculation part. You take the steps of side reduction depending on how the take is. Side reduction ensure that the powder is uniform, right? Check the size reduction, check the sifting. If there's any contaminant, true or false, you sift, then go down to here now, you weigh 2.8 gram, okay? You weigh 2.8 gram. After weighing 2.8 gram, you don't need to mix with anything again, true or false. You have to start mixing is not necessary again. Because there's no other excipient. Remember, our definition of powder as a dosage form. Pharmaceutical powders are what?
So the solid dosage form of medicaments, which one or more drugs are dispensed in the final divided state,
with or without. So this is after or without now. This one is without any other what? Excipient. But then hydrogen bromide was with what? Excipient, because of the quantity you are dealing with, which was lactose. But this one doesn't need any other what? Excipient. It's alone. So you have weighed the drug. All you need to do is just, after weighing this 2.8, from here now, you cannot do what? Where you are, from the individually, you start weighing 1 what? 40 milligrams. Am I completing? And the wrap, following the steps we discussed yesterday, the steps of folding your paper, you wrap. Do you know why you did that? You cannot go to the bag, the entire bag of the drug, and weigh only 140 milligram and come and pack, wrap and keep, and go back again and weigh 140 milligram and wrap and keep. No. You weigh the quantity that will give you the number of wraps you need. From there, you cannot be taking your 140 and be wrapping. Am I communicating? So that's for this one, okay? Now remember I told you that this can be prepared in 2 different ways. Sometimes there may be this one will involve a little bit of calculation. Sometimes there may be no pure ibuprofen as powder for you in your pharmacy or any place you are working. What are you going to do? And you need to compound this. Maybe you need to formulate this for the patient, maybe a baby. What do you now do? There is no pure ibuprofen, but you have ibuprofen tablets. What are you going to do? So how are you going to know the quantity you are going to use to give you 140 milligram per wrap? This is where calculation now comes in. So So if you don't have such, you know, if you have the pure one, it's simple, right? But if you don't have, you have to do the calculation. So you can deliver the actual dose for the patient. So in this case now, what they're going to do is this. Ibuprofen in the market now, you have 400 milligram in the market, you have 200 milligram, okay? Yeah, we have the one that is 400 milligram. What it means is that 400 milligram is not the weight of the tablet, no, you know. It's the weight amount of what? Ibuprofen inside the what? Tablet. Just as you hear something like paracetamol, 500 milligram. If you get a tablet and weigh it, it's more than 500 milligram. Are we together? It may not be that 500 milligram. Because that paracetamol drug inside it and other what? Excipients. So that 500 milligram is the weight of the paracetamol, the amount of paracetamol itself inside the tablet. The same way now, if you see ibuprofen, 200 milligram, that tablet, what is inside, the ibuprofen inside the tablet is what? 200 milligram. There are other what? Excipient there that will contribute to the weight of the what? Tablet. Are we together? So, because you are told to produce 140 milligram to compound 140 milligram wrap that contains 140 milligram of what? Ibuprofen. Here now, what you do is this. Let's assume that you use ibuprofen tablets, 200 milligram. What you do is this. First thing to do is this. Get the ibuprofen. Remember, you have 18 powders. Because this is 200 milligram. The difference between this and 140 is not much. True of us? Yeah. So the best to do is to still get 20 what? Tablets. Okay? Still get what? 20 tablets. Had it been you have, what you have in your shelf is ibuprofen, 400 milligram. You can get 10 tablets. Because 400 is far above what? 140. Now, you can get the same 20 tablets. Now, if you get 20 tablets of ibuprofen, 200 milligram. First of all, the first thing to do is this. You have to weigh the 20 tablets to know the weight. Do you know why? You want to determine the weight of the tablet itself, not the weight of ibuprofen inside it. You know that 20 tablets of ibuprofen. Now let me ask you a question. If you get 20 tablets of ibuprofen, 200 milligram, what is the amount of ibuprofen in the entire 20 tablets? If you pick 20 tablets of ibuprofen, 200 milligram strength, what is the amount of ibuprofen in the entire 20 tablets? 4,000, thank you. 4,000 what? Milligram. But if you gather that 20 tablets and weigh, it will not give you that 4,000 milligram. Because of what? Other excipients. So that's the reason why you should, the first thing is to weigh, to determine the weight of the what? Tablet. Are we together? Yes. Good. Now, if you do that, you keep the record. Let's assume, let me just fix a particular amount. Okay, this now fixing is not realistic. I'm just fixing something to help you understand what we are talking about. Okay? Now, let's assume that one of the tablets, let's assume that one of the tablets of the ibuprofen 200 milligram, the weight is, let's assume that the weight is, let's assume it's 500 milligram, okay? You just an assumption, okay? Let's assume that the weight is what? 500 milligram. Let's assume it's 500 milligram. Now, for one tablet, and the ibuprofen inside it is what? 200 milligram. Now, what it means is that if you get the 20 tablets, now the weight of the 20 tablets will be what? 20 times what? Times what? Which is what? 10,000 milligram. So the weight of the entire 20 tablet is what? 10,000 milligram. But the weight of ibuprofen inside that 10,000 milligram is what? Is what? 2 times 200, right? Is what? 1,000 milligram. So we have 4,000 milligram of what? Ibuprofen inside what?
Inside the tablet.
In what? 10,000 milligram what? True of us?
Yeah.
Good. Now, at this junction now, you have determined something now. Okay? So what you do is this. You will do what? Crush the what? Tablets. Okay? You crush it. You pulverize it. Make it to be in powder what? Form. So if you crush the tablets, you will now sieve, okay? Make sure that you sieve it well. Then, the next thing you will now do is that you now start the main calculation. Now, because whatever is inside that thing has already been properly mixed before you even crushed it. So whatever quantity you take will contain a proportional quantity of what? Ibuprofen inside it. Remember your target. Your target is to do what? Your target is to do what? Produce 140 milligram of what? Ibuprofen, right?
Yes.
Now, since you know that you have 4,000 milligram inside what?
10,000.
Of the what? Of the what? Tablets. How many do you think this 140 milligram should now be inside what quantity of the powder? You have 4,000 milligram of ibuprofen instead of 10,000 milligram of the what? Tablet, right? The tablet, right? Now, okay. Now, if you have 140 milligram of ibuprofen, in what weight will it be in? Do it and let me know. Now, open this. Three what? Three what? 350, right?
Yes.
Good. So, $350. Now, if you now want to, are we together?
Yes, sir.
Are we together?
Yes, sir.
Are we really together?
Yes.
Believe you me, if you weigh 50 milligram of that powder, it will contain what? 140 milligram of what? Ibuprofen inside. So, do you know why we did 20 now? You know why we did 20 for 20 tablets. Now, this is the reason. Now look at the reason. When you have pulverized it, it's not in powder form. Some you lose some. True of us. If you weigh that powder that is remaining, if you weigh the tablet weighed 10,000, but believe you me, if you weigh the powder again before taking it, you can't get 10,000. True of us.
True.
Some will be lost, normal. Now, but because it was uniformly mixed even before tableting, it doesn't matter. Once you crush it and take 350 from it, that 350 you take will contain what?
140
Of what? Ibuprofen. So from that thing you have pulverized, you start taking what? 350. 350. And if you take 350, because of the average you put, you get up to 18. You get up to 18 powders. But you may not get up to 19, but I'm sure you can get up to what? 18 from it. Unless you are too careless that a lot of them pour what? That's where the issue comes. That's why you should be very, very coordinated when you are in the lab. That's why sometimes it's good, no matter the background you came from, try to comfort yourself. Because you are dealing with people's life is in your hands. Three of us, take it or leave it. If you are a type that talk too much in lab, you talk. You are not good, you push the powder, boom. You pack small. You can't get up to 10 powders. Three of us, you cannot. But if you are careful, the loss will not be much. You can even get up to 19. So, but if you are careful, I'm sure you can get up to what? 18 powder from it. In that way, you have actually prepared what? 140 milligram of ibuprofen water. Are we together? But do you now know the difference now? When you are working with the P1, the powder will just weigh 140 milligram, true of us. Because there's no what? Excipient. Let's assume that the tablet is perfect. Remember, this is on an assumption that the tablet is what? Remember? And now, that means plus excipient, you have 350 in the what? Right. Does it make sense? Does it make sense? So, does it make sense? So, this is what you, another phase of what? Individually what? Wrap powder. Can someone remind me what I told you last semester about this type of compounding? Where you don't compound you don't do the extemporaneous dispensing directly from the raw material. You use already maybe tablet and grind it, make it in put water and make it in suspension or in powder form. Who can remember what I said about it last semester? Who said that? You go far. It's pseudo because you can't really call it. It's not from the scratch. Even though there is extemporaneous, you did that because you don't have the ingredients, but you have another dosage from already in your pharmacy. You use that one you have, and that's exactly what happened here. It's possible that maybe a precision is there. A precision may come in for such. This a precision may come in for this type of thing. But you don't have the ibuprofen powder. What are you going to do? But you have the tablet in your shelf. Once you do your calculation well, most of your parents do this, but they don't even know the dose they are giving. True of us. You do it, they do it without even doing the calculation because they don't know it. Now you can do it confidently. Giving exact, all they do is they just get it and crush it and put water. They don't even know the amount they're giving. True of us. And it's dangerous. It's dangerous. Before you do anything like this, you must do the calculation, know the exact amount you are doing. Whether it's that this so, and this so, and at the end you are delivering the same 140 milligram of what? Ibuprofen. So that's why there are some say that they will just get, that one I saw one day, she just got one cough syrup. And got is it Ventolin and Celtrate and crush them and pour them inside that what? Cough syrup. I was like, man, people are taking risky. And the things that they're not going to take it is the innocent children that are taking this test. Tomorrow you say that you don't know what's happening to your child. Are we together?
Yes, sir.
So that's what happened here. So with this, so of course remember this. My focus is on the calculation. Hope you know. But this whole thing follow the same pattern. You have to follow the same what? Pattern I listed yesterday. What differs is the what? Calculation, okay? Good. Am I communicating? So you now package and do your thing. Now, but there's something here. Be careful about. What do you say about ibuprofen? What type of drug is ibuprofen in terms of light?
In terms of light.
In terms of light. Is what? You forgot it.
Is it like photolabite?
Is it photolabite?
You say in terms of light now.
Is it?
Yeah.
Is it? They have forgotten. I check your material again. If you have them, check when we talk about photolabite. Bro, check it.
You said they are put in an amber bottle so that.
The question is ibuprofen? Is it one of them?
Yes.
You are not sure. Confirm it and let me know fast. What you just did day for yesterday, you forgot it.
No.
Last year, it's not this class last year. It's day for yesterday now. Last month, you forgot it immediately. No. I won't agree. I disagree to agree. Oh, yeah, tell me. There are drugs we listed that are photolabite. Is ibuprofen among them? That's the question. Confirm. Check your material again.
No.
Is it?
No.
Okay. What drugs did I tell you last semester? Okay. Oh yeah, Google it. Is ibuprofen photolabite? Oh yeah. Please, welcome.
Did you give us ibuprofen as an example?
Yes.
Google it now, fast. Please, if you go to my class, always make sure that you have data. Yes. I am Google it fast. She said we're going to have Wi-Fi. Okay, now that one is ideal, but in reality, you live by reality. Is it? Huh? I say you should Google it now. I said yes. Is it? Yes. Who said yes? You saw it? Yes. Oh, yeah, read what is there. Fast, no time. Please, let's listen to her, please.
Photo protection of like ibuprofen and lactocin has been approved through the corporation of drugs. They just say
Down here, they say that this has not yet been documented for ibuprofen.
Is that what?
It has not been documented.
What is that? What are not been documented?
After all their statements, they say that this has not yet been documented for ibuprofen.
What is not documented?
It's being photolabite of necessity drug.
Read what is there. Fast.
Okay.
Ibuprofen suspension, Is what?
degrade by direct.
Degrade by what?
Direct photolysis.
That's answer the question. What is photolysis? Lysis by what? Light. True of us. Ibuprofen suspension you see in pharmacy. What about bottle does it come with? You think that is for joke? Huh? Good. So the point I want to make here is that hello, that this can be packed in amber what? Box, okay? After wrapping it, you should pack in an amber what? bottle, okay? Amber, glass bottle, or what? Glass jar, sorry. Then you open it. Because of the what? It's the effect of light on it. You know, effect of light of what? On it. So that is the point I wanted to make here. After wrapping it, you should do what? You should do what? Store it in what? Store it where? Amber glass jar. Amber what? Glass jar. Or even plastic container. You know that plastic container? That one, it can be penetrated through of us. So you can store it in plastic container or amber glass what? Jar. With a screw what? Cap. With a screw what?
Cap.
The screw cap. Good. Why do we use screw cap? Airtight, right? So you store in a cool, dry place. The shelf life, at least 2 to 3 weeks is okay. The shelf life, 2 to 3 weeks is what? Okay, for the shelf life. Shelf life. So with this, I think we have done justice to the divided what? Powder. Divided what? Powders. Now let's go back to undivided powders. Okay? Let's go back to what? Undivided powder. Which are the bulk what? Powder. The bulk what? Powder. Now one thing I want you to know about this, remember I said it yesterday, it's just a reminder. Are we together?
Yes.
Good. Yesterday I told us that the undivided powder we have the one for internal use, the one for what? External use. The typical one for internal use, I made mention of compound magnesium trisilicate what? Powder, right?
Yeah.
I think in your second year you will compound this in the lab. At least I'm sure of that one. Bulk powder. Compound what? Magnesium trisilicate what? Powder. Then oral powder, BP. Is BP 19? Spray what? Spray. Miss Man, is it a spray? Okay. I'm surprised. So now, all right, let's look at this. Specifically, you have a formula. Let me write out this formula. Then you tell me what you think. I have laid the foundation, so you tell me what you think now. Now let me write the formula for you. Let's see how we can do. Powder for what? Internal use. Okay. Look at this. We are in powder for internal use. Bulk powder or undivided powder for internal what? Use. I want to write a question. Then you tell me what to think. Especially on the calculation what? Aspect. Now, the question says, prepare 200 grams of compound magnesium trisilicate oral powder BP. Oral powder BP 1988. That's the question. Prepare 200 grams of compound magnesium trisilicate oral powder what? BP 1988. I'll write down the formula in the official book. Then you tell me, someone should tell me what to do. Tell us what to do. Let me know that we'll go far. When I say go far, I mean in this profession. You can go far in any aspect of life, okay? That you're not doing well here doesn't mean that you not go far. I'm talking about this profession, okay? I'm talking about here. Now, look at the question. Question says, prepare 200 grams of compound magnesium trisilicate oral powder BP 1988. This is the formula as stated in 1988 what? BP. You know that this pharmacopoeia they come in different times, okay, periods, okay. So this is one for 1988, published in 1988. So this is the formula for this. So what have I been saying here since? Okay, you want S square is equal to is that what is the formula? No. I said yesterday now about enlargement and the relational formula, right? So this is the formula in the official book, okay? The formula of a formulation contains the ingredients and the amount, okay? As stated in the official book. Now this is the official book. This is an official paper. Remember when we discussed official preparation now, right? Yes. I am making that thing in the first semester practical now. Yes. This is official preparation we are talking about. Because this was taken from where? BP 1988. So this is the formula. Now, I want someone that will go far to tell us what you think we can do here. Remember what I discussed with you yesterday. Alright, I give you 2 minutes to do that. 2 minutes. Yeah. Someone should tell us. Huh? Yes. Huh? You wear what?
By doubling of
Hello. You say what? This is milligram. Who can tell us what to do? Please listen. We are serious here. Huh? Any idea? Try. Listen. Huh? Keep quiet. Huh? Please, silence. Please. Huh? Talk.
You said you should do 1/10. Is it that
1/10? No. Okay. Huh? I said something yesterday. Okay, so remember yesterday? Okay, okay. Remember yesterday I told us something about enlargement of formula. Enlargement of formula. I told you that if you have the formula in the there may be a formula in the master formula in the official book that contain a particular amount of ingredients you need for the preparation. But you may be told to prepare a particular amount of the medicine that is far above more than what you have in the formula. You do what? You enlarge the formula. Let's assume that this is for, if you want to know the amount of this now, if you add up this whole thing now, you will get 1 gram. True of us? True of us?
Yes.
You get 1 gram. You get 1 gram. But you are told to prepare 200 grams. What are you going to do? You enlarge this formula and get the formula that will give you the quantity for 200 what? Grams. I said this yesterday. Because what you have to produce to compound 200 grams. But what you have in the formula, if you add this thing now, it will give you only just 1 gram, 1,000 milligrams, which is 1 gram. What are you going to do? You have to enlarge, okay? Tell us.
Did you say we have to calculate all of them together?
Yes, now.
1,000 milligrams is equal to 1 gram. 200 grams is equal to X. Plus multiply.
Do it and tell me the answer for first one. Tell me the amount you need. This is the amount for 1 gram of compound magnesium trisilicate. This is the amount for 1 gram. What will be the amount of each of them for 200 grams?
200 grams.
Huh?
200 grams. For each of them.
For each of them. For each of them.
50. Okay, 50.
50,000 what? Move it to gram.
Move it to gram.
50 grams, right? Yeah. So each of them, you need 50 grams of each of this to be able to produce 200 watts. Yeah, because if you do it now, as you say, if 1 gram contains 250 milligrams, right? Now how many will 200 grams contain? Is what? 50 grams. You do the same thing for all of them. They give the same thing. So this one is 50 grams, right? This one is what?
50 grams.
This one is what?
50 grams.
This one is what?
50 grams.
And the one is what?
200 grams.
So if you actually want to produce, formulate 200 grams of this, what are you going to do? You need 50 grams of each of this. You have expanded the formula. You have enlarged the what? The formula. You have 50 grams, 50 grams, 50 grams, 50 grams of each of this. But remember, in practice, you need to put your what? Overage. Remember, you put your what? Overage. Because if you weigh exactly 50 grams like this, by the time you finish your compound, you will not get 200 grams. But you don't just add anyhow overage. You add it proportionally. See what I mean by proportionally? You can say, okay, let me prepare for 210 what? Grams. Okay? Instead of 200 grams, you can say, okay, let me add 10 grams on this 200 grams. You now say, okay, if this one is 1 gram, right? 1,000 milligrams, which is what? You can now say, okay, if 1 gram contains what? Contains what? 50 milligrams. 210 what?
Milligrams.
Gram will now contain what? X. Sorry, thank you. 250 what? Milligram, right? You can say, okay, if 1 gram contain, see, to avoid confusion, you can move this to, or don't worry, maybe after the calculation, you move it back to what? Gram is okay. If 1 gram here contains 250 milligrams of magnesium what? Trisilicate. Remember, you have added overage of 10 here.
Yes.
210 grams will now contain how many? How many?
52,500.
Which is how many grams?
52.
52.5.
2.5 gram, right?
Yeah.
52.5 gram. You also do that, so because you have added overage, so everything here will now be what?
52.5.
52.5 gram, right?
Yes.
52.5 what? Gram. 52.5 what? Gram. 52.5 what? Gram. Multiply by 4. What will it give you?
200.
No, it's not true. It's 210, right?
Yes.
210 grams. So if you this is the calculation you will do. If you now want to compound this, you follow this process. Remember, you are sieving, side reduction, sieving, weighing now. You are weighing 52.5. You will not weigh 50 grams. You weigh what?
52.5 grams.
After weighing 52.5 grams of magnesium trisilicate, 52.5 grams of chalk, 52.5 grams of heavy magnesium carbonate, and 52.5 grams of what? Sodium carbonate. But if you weigh this thing now, you mix. Remember, you are mixing, right? You mix properly when you are done. And when you are done now, inside, because this is a compound, this is an undivided powder. You are not wrapping it, hope you know.
Yeah.
You are wrapping it. You should be in a jar, right? From your mortar, you weigh exactly what? 200 grams. Don't be surprised that if you weigh 200 grams, the one that remains will not be up to 10 again. So at it being you measure 50 grams, you cannot get to 200 grams. You may get it like 180 grams, which is wrong. So that's why you add your overage. Remember I said that your overage should be what? Proportional. You don't just squeeze the other, add anything you like. That's why I added it here. So it will cut across all the what? Ingredients. So with this now, if you now mix well, from what you have in your mortar, you now weigh out what? 200 grams. That 200 grams you weigh out will contain 50 grams, 50 grams, 50 grams, 50 grams of this ingredient, provided you mixed properly. So the first step is this calculation we did. Trying to, because what you have in formula is 1 gram. You need to enlarge it to accumulate for what? 200. And that's what we did. Sometimes you may also see a formula in the official book that is far bigger, higher than the amount you have to do what? What are you going to do? You reduce. Using this pattern. Am I completing?
Yes.
So, don't worry, when you enter second year, this is a topic in second year. But you need it now because soon you start your practical. You have to understand the basis of powder what? Preparation. I can't jump it. That's why I'm teaching it now. So that by the time you come up, it will enter well. Okay?
Yes, sir.
Now, this is. Then any others, the storing condition now. For the labeling and direction for use, unlike the wrap divided powder, here now you have to put, for this now you have to put 5 ml what? 5 ml other spoon or cup the patient will use to do what? Because if you just say 5 ml, some don't even know what is 5 ml. Two of us. Some don't know what is 5 ml. So you have to dispense it with this, so that they will now measure it with that and do what? And take. Of course, you know, should they shake well before they use it?
Yes.
So again, you should pack it in amber glass jar. Okay? Again, you should do what? Pack it in amber glass jar. You should pack it in amber glass jar or what? Plastic container as usual. With a what? Screw guard. Are we together? You should also, for storage, you should also store in a what? Cool, dry place. Then the shelf life,
2 to 4 weeks.
make this one 4 weeks. Dot. 4 weeks. Okay?
Okay, sir.
4 weeks is reasonable. So this is for what? Bulk powder for internal. Bulk powder for what? Internal use. If you have a question, ask it. Because we are coming to the end of powders. Once I finish what I want to introduce now, we are done with powders. Next time you see me is granules. Okay, any question? Ask.
This bulk for internal use, like, does it have those?
Does it have what? Those, for children, you normal, you take 5 ml, maybe 5 ml, okay? But you know that as I say, that's why even in your tablet antacid, you can chew but normally that's in precision you see two tablet, chew 3 times a day. So you see chew 1 3 times a day, okay? But it's not that serious as for divided one. Am I completing? Yes. Because the dose is very, very important. You cannot tell the person, okay, I take it and go and do what? I'll be drinking it. No, you can't say so, okay? You have to give measure, like 5 ml for children, then for adults, like 10 ml or 15. In fact, sometimes you see adult 15 ml. So you see 20 ml some antacid. You see 10 ml, 15 ml, 20 ml. So if the dose is very important, it can't be changing like that, okay? But at least there should be measure. True of us. It's not soft drink you just open and start drinking. It's wrong. It's still medicine. True of us.
True. I give us another question.
Don't worry. Let's look at powder for external, bulk powder for external use. Bulk powder for what?
External use.
That's the example of here. You see you are dusting powder. Hello? Here now, example here is one of the examples here is here what? Dusting powder. So I will write, so someone said that I should give you more questions. So I will write a formula question on what? Dusting powder. Give you like 2 minutes. Let me see what you can come up with. Okay? Huh? Okay, so let's go. Okay, let's look at this question. For bulk powder for external what?
Use.
You're making noise, though. Now look at this question. It says, prepare 100 grams of zinc, starch, and talc dusting powder BPC. Zinc there is 25%. Starch there is 25%. Sterilize, purify, talc is 50%. Oh yeah. Let me know those that will go far. Oh yeah. I give you 2 minutes to do that. Come up with something under 2 minutes. I broke your name, sorry. You're making noise. The last I checked, you don't write with your mouth. Solve and give me the answer. That's what I want. Not noise. One minute more. Huh? What? You don't know what is percentage? Hey, now that percentage. Who has come up with something? Who has come up with something? Some people are not even doing anything at all. Your time is about to. Oya, tell us. Oya, gift, Oya. Say Oya. Angela, Oya. What did she say? No, you cannot be what to ground. You can never be what to ground. Okay, so now let's solve this and those. Look up, please. Just look up. The question says, prepare 100 grams of zinc, starch, and talc dusting powder BPC. Zinc, 25%. Starch, 25%. Sterilized purified talc is 50%. If you add this percentage, it's what? 100. You add it, is what? 100%. Total is 100%. So we move this percent to what? Gram. Okay? So if you have, if zinc, inside this is the formula you are given, right? Yes. Inside this formula, zinc is 25% of this 100, right? Yes. So the entire from this formula, the entire product is what? 100%, right? Yes. Yes. So that means for zinc, right? Let's calculate for zinc, okay? For zinc now, 100% of the products contains what? Of what? Of zinc, right? Yes. So 100 grams will contain what? Come down first. Let's know, okay? Okay, good. You can do it. You can do 110. You can do 110. You can do 110. But see, let me make a distinction, please. If you are, let's assume this is a theory examination, okay? Let's assume if you come up, maybe in farm card, I ask you a question like this. This is theory. Don't go and start putting your overhead, okay? This is for practical purpose. When you are not doing practical, it's in capital overhead, okay? But because I want this to be a kind of practical oriented topic, that's why I am putting it, okay? Okay. Because if you put it in normal calculation for theory, it may look somehow, okay? Yes. But just know that you need it for practice. If you are doing the practical, if you are actually compounding it, you need it. Now, so let's just add it because of the nature of the topic we are treating, because it's more of practical. Now, so this will now be what? X will now be what? 110 grams times what? 25. Over what? 100. Percent to do what? What the answer? 27.5. 27.5 what? Gram. So here should be what? 27.5 grams. For what? Zinc. So do the same thing for starch and the last one. Okay, 27 point what? 55 point what? 0 gram. So add up is what? 110 grams. 110 grams. Have you seen it now? Yes. Yes now. No. This is the calculation, right? Remember, this is practical. This is calculation. The first step is your calculation, right? Yes. Which you have done. So if you now want to now do the weigh, first of all, after this calculation that you know the amount to weigh, you now start your what? Your size reduction, size separation. Then after that you now weigh. What you will weigh? How even if you use 100 grams, you will get here to 25 grams. Yes. You cannot put 25 grams. It's wrong, because even if you weigh 25 grams, you can never get 100 grams of product. It's not possible because of the losses. So that's why you put this coverage and did this thing. So here now, you weigh 27.5 grams of this zinc, weigh 7.5 grams of starch, then weigh 55 grams of what? Sterilized tap and mix properly. Using your what? Geometric water dilution, right? If you mix properly, then from there, from whatever you mixed, you will now weigh out what?
100 grams.
100 grams. If you weigh out 100 grams from it, they will contain 50 grams of this, 50 grams of this, and what? So,
25.
they contain 25 grams of this, 25 of this, and 50 of this, making it what? 100 grams. So with that now, you are done with your what? Preparation. So after that now, you now talk of how do you package it? How do you store it? What type of labeling will it be? Am I completing? You know, you should apply to the what?
Body surface. Good.
Then secondly, that you should also write for external use. Very important. For external what? Use. And you know how you're, okay. Any of them you are using, try as much as possible to run away from it. Give that a bit so that you may use 105, you may end up not getting up to 100 grams. It's possible. Just give space a bit, okay? Like 110 is okay. In practice, it's okay. Am I completing? So I was saying something before I was interrupted. I was saying something. Okay, right? Good. The container, the type of container to use.
Plastic, metal, or glass.
Yeah, that's in powder. How does it come? Tell me how your dust powder comes. In what? Huh? It can be glass, it can be metal, it can be plastic. But another important point is the closure. You go for. Oh yeah, remember, you open, you shift it, right? The pores will be exposed, right? You will now. Then after you do what? Are we together? Good. So I think, okay, 4 weeks expiry date is okay.
Expiry date.
4 weeks, yes, or share
Nobody buys.
Are you preparing to sell?
Use the step of okay, the patient will be there.
You do to stay for months. Some of you are still confusing extemporaneous dispensing and the other one. We are discussing extemporaneous. Some of you are still confusing extemporaneous and prefabricated, proprietary. Those ones they are prepared for that. What preservative did you put in the lab here? You are providing this for the patient to give it directly to use, okay? Yes. So they don't need to last for that long. Are we together? Yeah. That's why it's extemporaneous what? Compounded. Please note this difference. Look at the person that said most now. I'm explaining that you're discussing. You are the one that made me know that you are still confused about this extemporaneous and prefabricated or proprietary. I am explaining that you are discussing. How will you now learn it when you are discussing? That's wrong. That's very, very what? Wrong. I think we are done with powders.
Use this.
We are done with powders. So.
Use this.
Is that what? Advantage and advantage. No, read that one up. Read that one up. I've already laid foundation for you on that one. I can't come here and be okay.
Classification according to size. That's not my understanding.
These are sieve numbers now. Sieve.
How sieve numbers?
No, each sieve have their number.
Is it the old?
The sieve have their number depending on the pores of that sieve. We have different sieve numbers. When you get sieves now for compounding, each other have their own number. That's why you see the sieve number. So sieve number.
So what of the percentage?
I should describe percentage for you again. If you have a powder of quantity like 100 grams, that's the quantity of the powder, and you are told that 60% of it, not more than 60%, can pass through the or let's say it occupies a particular volume, and you are told that not more than 60% can pass through this sieve. What does it mean? That can pass through 60 of it. 60, if you hear not more than 60 can pass through. What does it mean? Those that can pass through are not more than what? 60. True of us. If the entire quantity, if the entire size is or quantity or weight is 100 grams, not more than 60 of it can pass through. That's the meaning. 6% of 100 is what? 60. It's not true. It's not true. So it depends on the quantity of what you want to sieve. Am I completing? It depends on the quantity you want to sieve. So you are told that not more than 40% can pass through a particular sieve number. That means those that can pass through are less than 40% or less than 2 of us. Up to 60 of it cannot pass through if the total quantity is what? 100. But if the total quantity is 200, what does it mean now? What is 6% of 200?
60%
Of 200?
120.
120. So if you say that not more than 6%, that means less than 120 down can pass through. Above it cannot pass through of us.
True.
So that one is not an issue. So all those advantages we have dwelt on dosage form for a long time. So read that one up. And even when I was describing these individual powders, I mentioned disadvantages. The two of us.
Yes, sir.
So to read up those ones, on a general ground, advantages and disadvantages of what? Powders on a whole. So I think we have done justice to this. Ask questions.
What is juvenile activities? I said on your notes under ibuprofen powder.
And you're with your phone.
No, I'm not.
Are you serious? and you don't have your friends to ask to use their phone to browse. See, listen carefully. There's something I taught you. You don't wait until you come to class before you ask your lecturer. There's some questions that are direct questions you don't ask in class. Am I completing? Like now, let's assume that you are studying and you saw juvenile arthritis. You didn't bother to and you didn't bother to look it up, either with your medical dictionary or you didn't want to Google it. You preserve it to come to class and be asking a lecturer is a wrong attitude to what? Learning. Are we together? It's not a good attitude. On your own, try. Let's assume you have Googled it, gone through it, and you don't understand anything there. It's a different thing, hope you know. It's a different thing now. If you now come and I will not explain, not sir, what is, you have not even gone, you have to now, or you get phone and search it also. Someone should search it for us. Juvenile, yes. What children? Infrared, good. What else? Google juvenile arthritis now.
Juvenile arthritis.
What it is? Jalo. What it is? What it is? Someone has answered it too, but I don't want to. I want you to check it up on your own. Oh yeah.
And the symptoms.
What is juvenile arthritis? That's the question. Or symptoms. Ask Google what is juvenile arthritis.
It's a form of arthritis in children which causes joint swelling and joint stiffness.
Juvenile.
Arthritis.
Juvenile. Anytime you hear the word juvenile, it talks about what?
Infant.
Informazi. Okay? There are some adults that have juvenile attitude. True of us?
True.
Are you good now?
Yes, sir.
You didn't check it. You saw it. You didn't check it. No, see. You don't wait for me. The best way to help someone is to teach the person how to do what. You don't give person fish all the time. Teach them how to do what? Catch that fish. Okay? That's why sometimes if you ask some question, I'll tell you, check it up. Because you are supposed to check it up. First of all. Maybe after taking it up and what they're saying is not clear, then we don't talk about what? Explanation. Two of us. Just like you have your phone, you have your Android phone, you've been on TikTok, you've been on Facebook all the day, and you were there enjoying yourself. Now you maybe a particular word is in your hand that you couldn't get that same phone you have been watching TikTok with to browse it. No. It's an error. Two of us. It's an error. Because your phone is not meant for that. As a student, your phone is meant for your what? Academics. Your data is meant for your what? Academics as a student. It's not for your status. It's not for your posting your WhatsApp status. It's for your academics. So, hello? So if you are fighting, if you are struggling to get money for data, and you secure that money for data, keep it for your studies. I keep saying this. You know yourself, people come from different words, background. People come from different words, background. Some come from very rich and wealthy world. They can afford to watch movie on YouTube throughout the day, and nothing will happen to them. And you are managing
50 MT.
and you're using it for TikTok, for status. Who are you posting that for? Keep it for your studies. Because you know where you're coming what? From. You know that if you waste it, where you want to study, you don't have that time. So why wasting it? Because your friend posted, you post. There are people that, as money comes from different sources in their account, you have the same thing with that person. I am following the person. In this era, data is life.
Yes.
In this era, you cannot do without it unless you want to remain in darkness. Hello? Unless you want to do what? Remain in what? Darkness. People from different parts of the world are watching us now because they have what? Most of them are, most of them are not Nigerians. They can do that because they have what? And they are there. They stick to it because they know the importance of what they are watching. So please make use of your device in your spending. Don't tell me I don't have that. It's not true. You wasted it. And sometimes most of the material you browse is in range of, hello please, sometimes most of the material you browse for your studies, textbooks you browse online, the material you download, most of them are in KBs. Highest, tell them the two of us.
True.
Most of the material documents are in KBs.
Yes.
So don't tell me you don't have that. You wasted it on frivolities. You forget that you are what? A student. Hello, as old as I am, if I'm studying, listen carefully. So some of you are playing. There are some, most of the things I tell you here, people pay for it. You are getting it for free and you are playing. People pay for seminars like this. And you're getting it on you are wasting it. Continue. So the point I'm making is this. As old as I am, by age and in the profession, I cannot read without my phone and my data on by my side. It's not possible. Because each line I read, there's something I must check on. And make some note from it. That is how you should study. So preserve your data. That you don't have data is a lie. Put it well. I wasted my data. That's the right statement to make. Not I don't have data. It's not true. All right. We'll stop here for today. All right. Thank you very much. And God bless you.